Hi, you guys. Welcome to Ask the Egg Whisperer. I grew up with a mother who used the word erection every time she talked about an election. So she always say, Aimee, did you vote in the erection? And she thinks it's really funny. And this is a big erection right now that we're dealing with. See, now you're going to always think of the same word every time you hear the word election all night long. So welcome to Ask the Egg Whisperer. Thank you guys for sending in your questions. And I hope I'm making you laugh just a little bit tonight. So anytime I see you guys join me, it just makes me super pumped and fired up because I know it just means that this world is going to be a better place because people like you are out there who are working really hard to grow your families and bring more love into this world. And let me tell you, there's nothing that is more selfless than bringing a child into this world and raising that child with so much love. And I'm so glad to be a part of all your lives in this way. So thank you for joining. Snuggle up. Grab your cup of tea. I have mine right here. My cool little cup right here that someone made me. And we'll talk about making babies, okay? So I'm going to start reading off the questions. I don't have too many tonight because I want to run home and watch the erection. For those of you who are just joining me, you got to watch the top of the show so you know what I'm talking about. Okay, so this question is from Aimee, and Aimee is saying, hi, Dr. Aimee. See, we have the same name. Can a diet high in sugar cause egg quality to deplete by early 30s? So my answer to you is no. Typically, your diet and what's skin deep, what I tell people is your fertility isn't skin deep. However, you are what you eat. Doesn't cause your eggs to disappear. So if there's something going on like that, like you've been diagnosed with decreased ovarian reserve, certainly you want to do everything that's in your power to give yourself the best chance of pregnancy. And that includes looking at your lifestyle and seeing what you can do to make it healthy. But I don't want you to think that somehow you eating sugary treats has caused your eggs to disappear. That's just not what happens. So your egg quality is determined by 3 things, and those 3 things are all in the word age. So your age, your genetics, and your environment. So these genes are things that you inherit from both sides of the family, and we can't control those things. Your age is something that just passes over time, and we don't age backwards. Certainly your eggs don't either. And your environment, like your body size, how do you take care of yourself and your diet, are things that can affect egg quality, but they don't make your eggs disappear. So I don't want you to sugar shame yourself. I just came up with that word right now. So this next question is also from Aimee. Why do some IVF protocols do estrogen priming at the beginning of the cycle? Which patients are good candidates for estrogen priming? So when it comes to estrogen priming, some doctors use that to prevent the lead follicle from growing at the very beginning of the cycle. Some people use it to also control the cycle. I sometimes use it. I don't like to always use it. And the reason is I like to use the FSH estradiol at the beginning of the cycle to give me a really good idea as to what's going on with my patients. I like to use those levels as a guide for egg quality and what's going on and if this is a good cycle for us to move forward with. And if you're estrogen priming, your estrogen is going to be high and your FSH is going to be low, and you can be tricked into thinking that everything is fine if you look at your FSH, and we don't get tricked around here. We like to have all the information up front. But if I am going to do estrogen priming with the patient, I'm always going to explain that to them and say, look, if you're doing an estrogen priming cycle, you can't use your FSH to determine if this is a really good cycle for us to move forward with or not. My average egg count for my patients is going to be under 10 because most of my patients are over the age of 39. But yes, estrogen priming is one way to do things. Ask your doctor specifically, why are you using this protocol that you're using on me? Why are you using these medications? How did you choose these doses? And what do you expect from treatment? You guys should know that IVF pyramid that I talk about a lot. You can go to my website, draimee.org, and put in the search engine, what is IVF, and you'll see the IVF pyramid that's there. And you can print that out, take it to your doctor, and say, what does my pyramid look like to you? And have them explain that to you at the beginning of your cycle. This next question is from Kyle. Hi, Kyle. After my retrieval, I had a physical exam 2 days after. Quite a few of my results that usually are normal were low. I was low on specific gravity urine, bilirubin total, blood urine, nitrogen, osmolality, and sodium. Do you think these low results could have possibly been affected by fertility meds? I have a transfer at the end of November. Do any of these tests affect transfer, and should I redo my physical before a transfer? Thanks, Dr. Aimee. So, those kinds of results are a reflection of basically how hydrated or dehydrated you are. So I would just say repeat them, and they're probably totally fine. And the answer is yes. Your hydration status has everything to do with these results, and I'm not worried about them at all. If your creatinine was, for example, high, your BUN was high, then I would certainly worry that you need to hydrate more. But I'm not worried one bit. Sometimes when you look at these levels and things are flagged, they can scare us into thinking that we have certain conditions that we certainly don't have. but just repeat it if you're worried. And I imagine that it's going to be normal next time you check. This question is from Jessica, and she says, "Hi, lovely Dr. Aimee. Thank you. You're truly a gem, and I adore watching your series. Thank you. I hope to one day have a series." You guys, tag Netflix. Tell them we want a series. Just kidding. Just had the following numbers from my egg retrieval. 12 eggs, 9 mature, 4 fertilized, but only 1 made it to day 5, and it's a 3AA. Thinking of doing another cycle. My husband has pretty bad Malefactor infertility, and I have 2 questions. He's a smoker, marijuana, and cigarettes. Do you think our next cycle he should quit? Wanted to hear it from a doctor. Second question, what's the best multivitamin you suggest? Thanks, love you. Okay, Jessica, love you too. Your husband, I'm not a fan. He must be really cute for you not to kick him out of the house. You're giving yourself shots. You're getting probed by Wanda. You're doing all this crazy stuff, like getting super bloated. Come on, the least he can do is not smoke those sperm killers. So tell him, cut the crap. Cut the beep. You know what I'm trying to say? No more. Because honestly, I tell my patients, look, if you're going to smoke, you can go find another clinic. There's one down the street. Here's the address. The reality is that smoking cigarettes and marijuana cuts your fertility rate in half. It is so bad for sperm DNA, like so bad. And I can show you studies and I can share them with you, basically describing how bad it is. There was recently a study that was published not that long ago out of Boston showing that women who were partnered with someone who smoked, I think it was like twice a week, something like that, had like double the miscarriage rate than someone who was partnered with someone who didn't smoke when they got pregnant. So that's how serious this stuff is. I mean, you never want to like do a cycle and be like, well, next time let's not smoke. Well, let's make next time this time. And if you need me to scare him, what you could do is do some maybe extra testing, like a sperm DNA fragmentation test. But the problem is sometimes guys who smoke, even when you do those kinds of tests, their results still come back normal and they feel encouraged, like, oh, my sperm is still really good, so I can still smoke. But the thing is that the DNA stuff you can't really see with your eyes so much. So there are genes that are affected by cigarettes and marijuana. Just tell them to cut it out, okay? Cut it out. Okay, this question is from Marlene. I'm 40 years old and I would like to know which are the best supplements to improve egg quality to prepare you for IVF. Why I'm doing my first cycle of IVF. So as far as the supplements, Marlene, it's really simple. Prenatal vitamin with vitamin D fish oil, easy. So one of my favorite prenatals is the Theranatal from Theralogics, THERALOGIX.com. You can use the code all caps Tushy to get it. CoQ10, you can also get the NeoQ10 from that website. And then there are 2 others. I like NAD from True Niagen. You can get it from any company. It's all made from the same company. And then another supplement called Pterostilbene. Let me just find mine. This is mine. I'll just show it to you real quick. It starts with a P so you can see what I mean. 150 milligrams. Someone is saying, thank you for the scare. My partner is watching. Oh, he should be scared. Okay, so then moving on to the next question. Kathy. Kathy is asking, hi, Dr. Aimee. I'm 40 years old with 3 PGS tested embryos. Recently, I got my blood work done with a reproductive immunologist. And here's the deal. It turns out I have MTHFR, ANA that's high, 1 to 40. I'm positive for 1 copy of the 4G variant for Pi 4G 5G, low serotonin levels, TNF alpha IL-10 ratio 44.5, leukocyte antibody detection is negative, high cytotoxic B cells 7.4%, lots of stuff. With the lab results, here's the question. Should I proceed with treatments with immunology first before doing an FET? What would your protocol be for me for my FET after my immunology treatments? Should I go through immunology treatment to carry to term, or realistically, should I find a gestational carrier? In addition, did the immunology issues affect my embryo quality prior to immune therapy treatments? Do I need to do another egg retrieval while waiting for these embryos to be transferred? Okay, Kathy, let me tell you this. This is how it goes. When you do immune testing, you're always going to find something abnormal. I promise you. It happens to everybody. There's so many things that you could screen for, and almost everyone comes back positive for something. When I have someone who's over the age of 40 and you're going to do a transfer, I always go back to my simple recipe for success. And I know it doesn't succeed every single time, but at least if you go through this recipe, you're going to look back and be like, I didn't miss anything. So here's the recipe. Know your diagnosis, and it seems like it's probably age-related just because you're 40. As far as the immune stuff, I'm not too excited about that. Like, I'm not getting all fired up that you have an immune issue. It's super common to have an ANA titer of 1 to 40. As long as you don't have joint pain, you don't have a family history of, let's say, lupus, I don't really think you need to do much more than just say, yeah, that's a positive ANA. But if you're super curious and you want to dive deeper into the rheumatology stuff and immune stuff, you just really want to make sure, do I have an autoimmune condition or not? And you can check lupus anticoagulant, for example. I bet your doctor, looking at the list of stuff that you had done, already checked lupus anticoagulant. So I bet your doctor has also said, you know what, you should probably take Lovenox with your transfer since you're PI1 positive for that gene that you just mentioned. Otherwise, I would say I don't necessarily know that you would do more than that. Some people would say doing intralipid infusion could help your TNF-alpha IL-10 ratio. And one way to do it that I do for patients who request this type of testing, because I do have patients that request and I always honor their request, is have you do an intralipid infusion. You do it the night, or not the night. It would be nice if it was a night. They would just come to your house. But you actually have to go to the infusion center. It's basically 2 hours of your time, the day of the lining check, and then maybe once a month until you're about 4 months pregnant. Everyone's protocol is a little bit different. Talk to your immune doctor or whoever is recommending this kind of stuff to you. But at the end of the day, I don't think you need a gestational carrier. The recipe for success is the 4 things that are part of the Egg Whisperer diet. And it's not a diet. It's basically knowing your diagnosis, which we kind of just talked about. Going through your IVF cycle and, creating your embryos, which you've done. And remember the embryo diamonds, right? What day were your embryos frozen? What's the implantation rate per embryo? Which one's abnormal? Which one's normal? Which one's mosaic? Get all your official reports. Look and make sure that these embryos will help you reach your dreams. And what was the sperm quality on the day of the egg retrieval? I know that's a lot. Go to embryodiamonds.com, you guys, for those of you who are listening and you're just like, whoa, that is a lot of information. I want to make sure that I got everything that she said. But that's where you can go to learn about the 8 things that you should know about your embryos. And then remember the third thing, the E of the diet, is embryo transfer preparation. So you guys all know me well. You know I talk about doing a mock cycle or implantation cycle, especially for women who are over the age of 39, because you just don't know when you're going to make embryos again. If one of the tests come back positive, like the Receptiva test, and your BCL6 score is really high, I would consider doing more IVF. I don't think your immune testing had anything to do with your cycle or affecting your egg quality or anything like that. That's just my personal opinion, but certainly ask your doctor and see what they think as well. I hope this helps. And then last, the T is doing your transfer, making sure you're doing it at a time when you're super zen, super relaxed, and you're feeling really good, and you feel like you've checked everything, and you don't have anything that you are still wondering about. And you can always use that question that I have shared with you guys, and you just ask your doctor, like, what have you ruled out for me? Like, what have you done to prepare me for my transfer? And make sure they talk about things like looking at your thyroid, looking at your cavity, and talking about the implantation testing and why they would or would not do it for you. This next question is from Karen. Karen says, I'm almost 37 years old. We have unexplained infertility. Eye roll, please. You guys know what I'm saying when I say that, because unexplained to me means no one has taken the time to explain it to you, and we'll talk about that in a second. Just starting fertility treatment, the doctor gave me low-dose letrozole for 3 cycles. For the first 2 cycles, I seem to have ovulated early at day 12. For the 3rd cycle, I was having abnormal bleeding spotting through the first 2 weeks of my cycle. That has never happened to me before. I went in for an ultrasound. The doctor said I have a cyst and put me on birth control pills. So I'm confused. Did the letrozole cause the bleeding and or the cyst? Should I be avoiding letrozole for my future cycles, or should I take breaks between cycles? If not letrozole, what meds should I switch to? Okay, Karen, tushimethod.com. Go through the Tushy method and talk to your doctor about what the possible explanations are for your fertility issues. The T is for tubes, U is for uterus, S is for sperm, H is for hormones, Y is for your genetics. The Femera and ovulating early for the first 2 cycles, that's kind of normal. Sometimes it makes you ovulate early. So if you were my patient, I tell patients to start your Femera cycle days 3 through 7. Check for ovulation starting cycle day 10. If you have a positive before you're scheduled to see me around day 13, call me, come in, and we'll take a look at your ovaries, and we'll time things as precisely as possible for planning IUI or timed intercourse. I also talk to patients about doing a trigger shot, and that's totally optional, but not required. Everyone's journey is your journey. Your priorities are my priorities, and not the other way around. But whenever I have a 37-year-old that says that she has unexplained, I always tell her, well, you're 37 years old. We know that's part of the explanation. As we get older, it's hard to get pregnant, and I can't believe I'm telling someone who's 37 that she's older, but you know what I mean. You're not old. But from an egg standpoint, your eggs are just, there's a lower viability rate at the age of 37. So one of my Egg Whisperer golden rules, I know you're all out there listening and you can fill in the blanks. If you're 37 years old and you want 2 kids, go right to IVF. We scream at the top of our lungs, freeze your eggs, freeze your eggs, freeze your eggs. We don't talk to coupled people or people who want more than one baby and are doing it on their own, for example, to freeze embryos. So freeze your embryos if you want 2 kids, because if you're having a hard time getting pregnant right now and you're ovulating early on the femera, it could be a sign about egg quality. You want to pay attention to that. Look at your FSH, estrogen, your AMH. And I know I'm talking really fast, but I want to go home to watch the erection. That's funny. Okay. This next question is from Jessica. Jessica is saying, I'll be doing my egg retrieval for a day 3 fresh transfer. I'm freaking out from nerves and excitement. This is our first cycle. That's how I feel, Jessica. I freak out because I'm so excited when I help each person. Like literally, like the night before each retrieval, I'm just like, oh my God, I'm so excited to help this person. And I'm so pumped. It never gets old. I know that sounds really cheesy and it's kind of hard to believe. It's the dang truth. Okay, so let me get to your question here. How should I prepare to avoid OHSS and give us the best possible opportunity for success with retrieval and transfer? All my labs are normal. Sperm is normal. I'm 30. My husband's 32. We're looking at 10 possible follicles so far. Okay, Jessica, when you have 10 follicles, the likelihood of having severe OHSS is really, really low. Typically, when patients have OHSS, they're usually, I'm retrieving like over 20 follicles. So I think from that standpoint, you're totally fine. But I think the best question to ask is how can I have the smoothest recovery possible so I feel really good going into a day 3 transfer? That's easy. Here are my tricks. Number 1, salty drinks. Gatorade, G2, Propel. You don't have to go full sugar with the Gatorade. You can use G0. Coconut water is a great substitute too. Whey protein, WHEY. You got to drink it. You got to snort it. I'm just kidding. Don't snort it. Got to insert it. No, don't insert it. But whey protein, maybe 1 scoop a day leading up to your trigger shot and retrieval, and maybe increasing the scoops to 2 scoops per day. My patients who do this feel really good. They feel well hydrated. They feel like they're not malnourished. Because I can tell you, when you're feeling super bloated and having someone scream at you, and I don't scream at my patients, drink, drink, drink. Sometimes I have flashbacks from my sorority years. No, I was the designated driver. I was the biggest dork. I was everyone's best friend because I drove everybody while they were drunk and I was studying, because that's what it takes to be a fertility doctor. I was buzzkill. Okay, I digress. So things to do to prepare for your egg retrieval, right? So we talked about hydration, whey protein, colase. Listen to me, trust me. Poop emergencies are not something that people talk about, but it happens. Like people literally go to the emergency room because they can't poop after an egg retrieval because your ovaries are so swollen. That's a secret that I'm going to share with you. So colase, Miralax, take it. Trust me, it helps. Heating pad, I do recommend heating pad for my patients. So get a heating pad if your doctor recommends it as well. Tylenol and Advil, for example, leading up to your transfer, and even Tylenol after can be safe. So again, talk to your doctor. The advice here isn't to replace that of your doctor. It's just to get you to be able to ask questions. And the other thing, if you're feeling like crap on the day of your day 3 transfer and you're going in and you're like, I feel like crap, trust me, don't transfer. Grow your embryos, freeze them, and then listen to your body. Like I have patients who've come to me for second opinion consults and they say things like, I really felt bad going into my transfer and I knew I shouldn't transfer, but I still did it anyways and it didn't work. So I'm not surprised it didn't work. Like, don't do that to yourself. Like, listen to your body. Ask yourself on the day of the transfer, will these embryos help me reach my goals and dreams? Do we have enough embryos for our future family? Should this transfer work? Okay, right? Because I'm thinking really positive. And then the other thing that you can ask your doctor is on the day of your transfer, say, hey doc, I want to have this number of kids. Do you think that doing this transfer today is a good idea? Okay, so don't forget to ask those questions. I hope my answer helped. And thank you for bringing me back to my college days as people were shouting at me, drink, 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 but I was never drinking. Okay, this next question is from Evelyn. Evelyn is saying, hi, thank you for all that you do for all of us struggling through our fertility journey. You're very welcome, Evelyn. I'm 40 and I've just completed my 7th IVF cycle. I haven't gotten a normal embryo in the last 5 cycles and I'm feeling discouraged. At 37, I got 1 normal embryo, 1 normal from cycle 2, cycle 3, none. So I decided to transfer and I have a healthy boy. Awesome. I have 1 normal embryo frozen. At 39, I did 4 cycles, didn't get any normals. I've been trying a mini protocol, priming with birth control, then Clomid and Letrozole and Gonal. I make blasts. Although my best cycle, I had 1 day 5, 2 day 6, all 3 were abnormal. I just turned 40 and want to try 1 more to bank a backup embryo. It's pretty clear my egg quality is poor. Now my doctor is suggesting we try HGH, this 8th cycle. Holy smokes, woman, you're just as stubborn as I am. 8th cycle is my Hail Mary pass. I'm going to give it all I have. I'm taking supplements, exercising, and eating well. What else can we suggest? Or can you suggest? Okay, listen, Evelyn. This is the thing. With your next cycle, make sure that it feels really good. Look at the follicle count and compare it to your past follicle counts. When I do a cycle, I don't just do it to be like, I'm going to do it just so I can have closure. I do it because I feel like this cycle is going to be a good one. So if when you check your follicles, you're not getting a good vibe, like you don't feel like the follicle count is good, just hold off and wait another month. I do, with my patients, think about HGH priming and see if my patient is a candidate for that. So you start HGH twice a week leading up to your cycle start. And then in the cycle, you can even do HGH every day or every other day. And every clinic's different. Every doctor's comfort level with HGH is different. I've been using it since 2008, believe it or not. So I feel very comfortable doing it. The other 2 supplements, and you guys have heard me talk about it earlier on today's show, are the NAD and pterostilbene. I would have you add both of them. NAD 300 milligrams for some people can make your heart race, and that's probably why I talk really fast, because I take NAD. You can drop the dose down to 150 milligrams if you feel like a total spaz, like I am a spaz. Every day though, like I was born a spaz, like I have the spaz gene. I have to be studied. The pterostilbene is 150 milligrams per day. I don't have a particular company that I recommend for pterostilbene, but I do find that the combination of those 2 supplements with CoQ10 can help. As far as protocol, really look at what has worked for you in the past, and it sounds like you're doing all of that. But the one tip that I have that sometimes people don't realize is do a post-test consult with the genetic testing company that looked at your embryos and ask them, are my embryos truly abnormal? Is there a chance that any of my abnormal embryos could be mosaic? If there is a chance that any of them could be mosaic, please don't discard them and consider potentially transferring them if your doctor agrees with that plan. Again, some doctors have never had the experience of transferring a mosaic embryo to have it turn into a perfectly beautiful, normal baby. And I certainly have. And I actually have patients where I've done genetic testing on them and they're mosaic and they would have never known. And they're sitting here at 40 years old, be like, holy smokes, I have a mosaic. I'm mosaic for a certain chromosome and I'm totally normal. So you guys, it happens. No one is perfect. We all have abnormal cells in our body. But knowing if an embryo is normal is really important to all of us before we transfer, but sometimes those mosaic embryos can turn into healthy babies. And one of the things that breaks my heart, literally like it hurts really bad, is when patients might unknowingly transfer or unknowingly discard an embryo that could potentially be normal. And then the other thing is really look at the sperm quality and make sure that the sperm quality is amazing and awesome and the sperm sparkles. You guys hear me talking a lot about sparkling lately, and it's because there's so much negativity in the world. And I actually heard something on my way to work today that I thought was really fun. It was try to stomp out the ants, the always negative thoughts. Stomp the ants out. Stomp them out. And so when I think of ants, I'm like, what's the opposite? So you got to think about the sparkle. And so that's why I'm talking about sperm sparkling. And you're probably like, I have never heard of sperm sparkling before, but that's what we talk about around here. We want it to sparkle. We just want it to look amazing and awesome because you get one egg, but there's so much sperm and that one egg, I get one chance to make that egg sparkle too. So that's why having the sperm sparkle is important as well. So we talk about having the female partner take supplements and then the sperm source, we want them to take supplements and take really good care of themselves also. So it's not just so much about the guys just showing up. There should be preparation for them as well. They need to prepare your shoulders and your temples and your breakfast, lunch, and dinner and peel your grapes. And one thing that I tell my patients is I don't want you to lift a finger. So when you're home, just go, ah. Okay, guys, I hope I totally cracked you up tonight. I'm clearly on a roll. I'm going to run home right now and watch the erection coverage. Sparkling sperm. I'm glad you guys are finding me funny tonight. Okay, I'm just going to go through your questions here, all the live chatted questions to see if there's anything that I can help with that you guys might have questions about. So let's go through them right now. Going through. Okay, this question's from Jasmine. Jasmine is saying, my OBGYN refused to check to see if I possibly have endometriosis. My HSG and my SHG came back normal. I've been struggling for 8 years. Every test has been good. I don't know what else to do. Okay, Jasmine, this is the thing. If you have symptoms of endometriosis and your gut feeling is you have endometriosis, find an OBGYN that will listen to you and believe you. A laparoscopy is a very straightforward surgery that's done by a minimally invasive gynecologic surgeon. There's so many amazing MIGS surgeons out there. Obviously, with every surgery, there are risks. There are risks of pain, damage to adjacent organs, need for a blood transfusion, loss of an organ. The likelihood of that happening is probably 1% or less. So find someone that will listen to you and do the Tushy method and talk to you about all the possible explanations, because I can tell you that trying for 8 years is a long time. Something is obviously wrong. Something is not working. Either the egg and sperm are not meeting up in the fallopian tubes because of scar tissue outside the fallopian tubes, or there's a chromosome issue that either you or your partner might have. So please talk to someone who's going to do all that kind of testing and take you through it and give you an answer, because you deserve it. This next question right here, I'm going to go down the list. We're almost done. Do you feel alcohol is as bad as cigarettes for male sperm? Aimee, that is a great question. So I also tell guys, don't make your sperm drunk. Dizzy sperm cannot go straight. They get very dizzy and they cannot make it to the top of the uterus, okay? Drunk sperm don't swim. They just can't, okay? They're just like, oh, oh, oh. The reality is, though, that heavy drinking can affect sperm quality. And if guys are drinking a lot, what can happen is it can affect their body size. It can increase their sugar levels, and that is bad for sperm quality. So I always give my patients a Book of Mormon to go home with. And I say, please convert. Now, I wish I could be Mormon. Like, I would be the best Mormon in the whole world. The only problem is I drink too much coffee. But I love all my Mormon friends. All my prom dates were Mormon. But my point is this, everything in moderation is safe. But for people who have a hard time putting the alcohol down after 1 or 2 small servings, you should probably say none for me until my wife is totally knocked up. So that's kind of what I tell people. Alcohol in moderation, unless you have problems with your blood sugar or body size, then I would say none for you until later. And then you guys can celebrate afterwards. So this question is from Anna. Does Luveris help with egg quality or follicle growth? I've done 2 unsuccessful flare cycles, now doing antagonists with Purigon and Luveris. So Anna, you must not be from the US. Those medications are not necessarily used in the US. And the answer is Luveris is another way to stimulate the eggs. It's the LH hormone. So we have 2 hormones in our brains that tell our ovaries to grow eggs. That's FSH and LH. So you're taking both. That's great. I don't think it necessarily affects quality in a positive or in a good or a bad way. It could help in a good way by growing more eggs, so you get more eggs, and that means more, hopefully, good quality eggs. But it definitely helps with follicle growth. So the answer is yes to follicle growth. Let's see here. What are your thoughts on Lovenox for factor V Leiden and MTHFR, but only family history of clots? So my answer is yes. Obviously, the variant in your family puts people at risk for throwing clots. So if you were my patient, I would say yes to Lovenox. And I would even have you take it 3 months postpartum. So this question is from Elvisra. How early could you do Down syndrome testing during pregnancy? So the answer is 9 weeks. There's a company that's trying to even get it down lowered to 8 weeks. Also, can I take True Niagen and CoQ10 during pregnancy? And the answer is I don't tell my patients to take True Niagen during pregnancy just because it's pretty new and it's not something that we have an experience with, and once you're pregnant, it's like my work is done. As far as CoQ10, there are some patients that I ask to continue taking it, especially patients who have a history of miscarriage. So ask your doctor as well if they think that it's something that you should take, but I don't tell all patients to continue CoQ10 during pregnancy. Okay, let's see here. I'm going to go down. I think that someone is saying I have 28 follicles. Am I at risk for OHSS? The answer is yes. And someone asked about estrase for IVF cycle, and that was actually the first question I answered today. Jasmine is asking, will CIN2 affect my fertility? I just had a LEAP procedure 2 weeks ago. And so CIN2 to me means that you've been exposed to an STD basically. So HPV is what causes CIN2. CIN2 means cells in the cervix that are slightly abnormal. Removing the cells doesn't hurt your fertility. However, it might put you at increased risk of preterm labor and preterm delivery. So if you're a patient of mine, I would say, let's make sure your fallopian tubes are open. And then I would tell you, as soon as you're pregnant, it is super important for us to check your cervical length pretty often and ask the question, should I have a cerclage? The likelihood of you needing a cerclage is super low. But when it comes to pregnancy, you never want someone to say, well, next time we'll consider a cerclage after you've miscarried a healthy pregnancy, because that's heartbreaking. That's the kind of stuff that hurts, and that's the kind of stuff that I want to prevent, and that's why I do this show. Bon is asking, is a DNA fragment sperm of 19 borderline bad? And the answer is 19 is not bad at all. It's pretty good. Anything that's below 20 for me is in the good range. Anything above 20, especially above 25, I'm like, let's kind of see what we can do to fix it. Above 30, it's like, red light. We're going to really try and see what we can do to improve it before we move forward with IVF. Okay, what can cause a chemical pregnancy with a PGS tested embryo? Okay, So this is a great question. So chemical pregnancy with a PGS tested embryo is from the following things. It could be an ectopic until proven otherwise. It could be from endometriosis, for example, decreasing your implantation rates. That's why it's important to do the, in my humble opinion, embryo transfer testing or embryo transfer preparation that I talked to you guys about. And that's doing the ERA test or the receptiva test. Another thing that can cause a chemical pregnancy is just at a cellular level, the embryo just doesn't continue to grow past a certain point. It attaches, but the cells stop growing. And then, that's not something that we can predict from the very beginning. And that's what can cause a biochemical pregnancy. There's certainly so many genes involved in a healthy implantation. And if those genes are abnormal or they don't match up perfectly between the embryo and the uterus, that can also cause a biochemical pregnancy. So, do you have any recommendations in the Boston area for an IVF doctor? I'm having a really hard time finding someone that I connect with and isn't too aggressive. So you guys know my thing. My thing is your priorities are mine, not vice versa. Your timeline is mine, not vice versa. I mean, I literally saw a patient today that I met for the first time in 2013, and she's like, I'm finally ready now. It took me 6 years to figure it out, but I'm ready now. I'm like, cool, I'm still here. Same hair, same earrings, same outfit. I look exactly the same. Like literally. I mean, like I can't even think of one thing about me that's different. Maybe my socks. I probably had to get new socks and shoes. But yeah, so I have all the patience in the world for people. I know that sometimes in a moment, people aren't ready for something, but later things change. So I would say just keep interviewing. So there's Boston IVF, there's MGH, there's CCRM. They're all awesome doctors, and I'm sure that you're going to find someone that you mesh with. And if you don't, direct message me and I'll tell you who I think you should see. So I've had 5 chemical pregnancies back to back, just went through IVF and got 7 embryos, 3 were normal. Could this show a picture of why I had so many miscarriages? And so the answer is, if you haven't, it sounds like you've done genetic testing of your embryos. If not, please do it. It's possible that, maybe considering a protocol of Lupron, for example, 1 or 2 months with letrozole, that could potentially help increase your chances of implantation. So there have been some nice studies looking at recurrent implantation issues. Notice I hate the word failure, and how Depo-Lupron can potentially help. And I would suggest that you do the testing that I talk about so often on this show to rule out silent endometriosis. Someone's asking, if they extend my transfer date by 2 weeks, taking Lupron for longer, does that stop my period from starting till transfer? It seems like a long protocol that at some point I'd have a period. And the answer is yes. So if you take Lupron, you'd obviously have to take birth control pills as well to prevent a period from starting. If you're talking about the subcutaneous version. This question is from Cheryl. She's saying, I have a diagnosis of DOR. I've had 2 rounds of stem in which 2 embryos have been frozen on each cycle. We'll have 1 more stem cycle with a fresh transfer. Does this protocol sound good? And the answer is, yeah, that sounds great. Keep making embryos. You can never regret making more. It's just when we don't have more, and we need more, and we don't have them, that we get pretty annoyed. Okay, so this next question is, what do you say to women who have conceived naturally in the past but now struggling to get pregnant? I've had 3 failed transfers and a 4th ended in a chemical pregnancy. Is it bad to do? Is IUI dumb? So yeah, I mean, sometimes it makes sense to take a step back and be like, let's reconnect, let's regroup, let's figure out what the heck is going on, what is her diagnosis? And I've had cases literally like just like yours, like with me as a doctor. I'm like, I don't know, my gut is saying, let's just take a step back and just try an IUI cycle. And I swear, probably I have an IUI pregnancy from IVF patients, like at least once or twice a year. And I'm like, thank God we listened to our gut. And so it's just about like showing up, keep showing up. And then you're like, oh, hi. Oh, I'm going to keep showing up. And then as long as your tubes are open, your uterus is healthy, the eggs are still there and the sperm sparkles, there's still going to be a chance for pregnancy. So you obviously are very resilient and strong to have gone through as much as you've gone through. But make sure you've asked your doctor the question, what have you ruled out for me lately? That was really, really bad. I'm sorry for anyone's ears who are bleeding right now, but you know what I mean. Someone's saying, are you Persian, Dad? I think you're asking me if my father is Persian. So the answer is both my parents were born in Iran and grew up in Tehran, and they came here in 1975, and I was born soon after. I am, from the size of my nose, Assyrian. I'm just kidding. But all Assyrians can relate to the size of my nose because that's what makes us Assyrian. I grew up speaking Aramaic or Assyrian at home. We're a Christian minority from the Middle East, and we're all somehow related, is my theory. Okay. So I'm going to cut off the questions pretty soon here. I only have 4 follicles being shown on ultrasound prior to stems due to endometriosis. Is IVF egg retrieval risky? And the answer is no. It just depends on your age and your AMH. So 4 follicles is what your doctor expects. Remember that IVF pyramid. You want to go back to my blog article, What is IVF, and draimee.org, and then print out that article, print out that pyramid, bring it in, and tell your doctor, what does my pyramid look like? Because if 4 follicles is actually the expected number for your body, well, it would be silly not to be super ecstatic that you have 4. This question's from Emma. I'm doing a transfer cycle. This AM, I went to inject my progesterone, pulled back on my syringe, and it looked clear after I injected. I have blood in my syringe. What are the chances of embolism? The chances are probably 0. So the reason why that happens is as you were going in with the needle, you withdrew. There was no blood in there. And then when you injected and came out, some blood went into the needle. Like, you're going to be fine. If it was going to happen, it's going to happen. So Suro Mama said, you've always been so amazing with me, always responding back. Thank you. You're awesome. Thank you for being on Instagram, and I love following you and all your pictures of your baby bump. This question's from Dina. What is the best dosage of CoQ10 we can take in preparation for an IVF with ICSI cycle? And the answer is usually between 300 and 600 milligrams. I have patients take the Neo-Q10 from Theralogics. 1 tablet is actually equivalent to about 700 milligrams, so you can take even higher doses, like 1 to 2 tablets of that. So that's what I tell patients. So you guys, I love you, and I can answer these questions all night. You can tell I could just sit here with my glass of water and talk about fertility for hours, but I'm gonna jam because I'm super excited to watch TV as soon as I go home, kick up my heels, get my computer back on, and keep answering patients' questions and calls. So I love you guys, keep sparkling, and I'll be back here on Thursday. So those of you who chatted your questions, and if I didn't get to it, I'm sorry, come back though. Thursday, around this time, I'll try to be closer to 4 p.m. like I promised you, but patient care always comes first, and I hope you guys have a great night, and I'll see you all on Thursday. Have a good one. Bye, guys.